Hello. So I have a question for all of you. I'd like you to think of three numbers. I'd like you to first think of how long you'd like to live if we stayed the way we are, aging as we usually age. If you have that number, I then want you to think about the following question. How long would you like to live if you're healthy? For most people, those are different numbers. The third number, and what I'm going to be talking about, is how long would you like to live if you had the anatomy of physiology of when you were 25? Because all of those things are coming and they're going to happen so much faster than you think. So our buzz line, as you may have seen, was reimagine a lifetime. The goal of the company is to add 10 healthy years to your life, which is like giving you an extra day of the week. Our goal is to do prevention. I'm not trying to treat the chronic diseases of aging. I'm trying to literally prevent you from getting the diseases. Why should you listen to me as opposed to somebody else? So these are my other two co-founders. Declan Dugan was the former head of drug development at Pfizer. And Jim Mellon wrote a book called Juvenescence on anti-aging. And that's what we're trying to do, is trying to find drugs to modify how you age, I should say. What was surprising to me is if you smoke, then you increase your chance of chronic disease by 5. Going from age 20 to age 70, you increase your chance of getting chronic diseases by 1,000. So anything we can do to modify aging is truly going to have a profound effect. So there's drugs, which is what my background is. I've had the good fortune of creating 2 drugs that have gone to market, the number 1 drug in the world for prostate cancer, and the number 1 drug in its class for migraine. Happily, they've gone on to sales of $5 billion and $2 billion respectively per year. So I came to this from drug side of the equation. But what we found was there's a number of natural products that will modify how you age. And there's a list of those behind me, as you can see. We're working through them, and what we're doing at Juvenescence is we're trying to run clinical trials on them to make sure that they truly modify how you age. We have a pharmaceutical division, and we have a natural products division. Some of our products start out as natural products and become pharmaceuticals. Some of the pharmaceuticals go the other way. Because if all of us in this room had a drug that allowed you to live 10 years longer healthy, no way to get it on the market. There is no regulatory pathway for an anti-aging drug. But if it's a natural product, I can have it in the market in 2 years. So we combine these. The reason my companies have gone through $28 billion in market cap is because I make 10 bets, in this case 11. And I try to be right on 1 or 2. And if I do that, I would deliver an extraordinary return to my shareholders and happily make a number of employees very well-to-do and simultaneously, hopefully, treat a disease that otherwise isn't treated. This is a crisis, and people are unaware of just how profound it's going to be. This is going to be as bad as 2008 and as bad as COVID if we don't address the demographics. The picture you see behind me is showing the inversion of the demographic pyramid. There is not enough young people to support the elderly if they're stopping work at age 65. We need to keep them robust, healthy, and working. Even if they're just healthy, that changes the whole economics for society. Politicians are otherwise going to have to make some very tough decisions. My personal experience with politicians is they're not good at making tough choices. So this is our therapeutics division, and I want to show you how creative our scientists are. They take a lymph node. They take a liver that would not have a recipient. There's 200,000 plus people in Europe, in the United States, who have liver failure. There's only about 8,000 livers, and 2,000 of them are wasted because they don't find a recipient. We take that liver, cut it up 75, proliferate it, and we inject it into the lymph node. What's extraordinary about this, and the clicker isn't working, is that it then turns that lymph node into a liver. 400 animal studies, it was able to prevent the animal from dying of liver failure. We can do the same thing for a pancreas and affect diabetes. Unfortunately, as many of you know, elderly people haven't got the same immune response as young people because of an organ called the thymus. We can regenerate the thymus. We would prevent the aging of the immune system, which may not be important to many of you young people now, but it will be in years to come. We can also do the same thing for the kidney. So this is a platform technology. Currently, In the United States, it's an $800,000 procedure. It takes 8 hours to replace the liver, and we don't have enough livers. One liver, one patient. With this technology, one liver, 75 people treated through endoscopy. 1 hour procedure, in, out, and you're on your way using an endoscopy. On pathology, sorry about this slide, but basically when we gave pathologists a slide of the liver or the lymph node, they couldn't tell the difference. Exactly the same architecture. So this is a profound thing, and it affects the liver enzyme, the function of liver. The lymph node responds to exactly the same body signals as your liver does. We've regenerated a liver in somebody where it was failing. We can do the same thing with the pancreas, the thymus, and the kidney. We can turn the lymph nodes into mini bioreactors that give you the drug you need when you need it. Big market, opportunity. I said at the beginning that we wanted to give you 8 to 10 years of healthy living. There's a community in the United States, Amish, and if they have a variant of a gene, they live 8 to 10 years longer. The light blue curve behind me is the people who have the genetic malformation. The dark green curve is normal. They're living 8 years longer healthy through a pathway called Pi1. My scientists are working on that. We're hopefully in the clinic next year. So our goal, allow you to live longer healthy. We also have a ketone product, and ketone is very important for the effect that it has on a variety of organs. It makes your heart more functionally better. What we were surprised to find in the last 10 years is you don't have to starve yourself to get into ketosis. You can take a drink or powder and you go into ketosis. And we run it like a clinical trial. I can tell you when you take our product, in 15 to 30 minutes, you'll be in ketosis for the next 3 to 6 hours. It will allow your heart to function better. It prevents your brain from aging. And at University of California in Davis, they found that it allowed the animals to live 25% longer. Healthy. Key. Multiple organs it's affecting. We ran clinical trials. It legitimately changes heart failure to the point that what was started out as a supplement, we're now taking it into a drug. This one's extraordinary. This is science fiction becoming science. So right now, the leading technology is like me soldering a computer. If I need to make a change, I had to solder it. Now, we just do it with software. We get the same effect of modifying a computer system. What you are seeing on the left side is a cell that is going to a fetus. Embryo has just become a fetus, and these are the cells talking to each other to reorganize to become you. Bone, muscle, nerve, tissue. They're doing it through electronic communication. Our scientists have figured out how they talk to each other, and we can now change that to make changes. Unfortunately, you can see what they did with a frog, where they've got a hand. They programmed a hand to grow out of the head. We published in January 6th that we cut off the leg of a living entity. And if you saw that, where they touched the leg and it moved, that leg did not exist 4 months earlier. What did you just see? Bone intact, nerve, motor, sensory. They regrew a functional limb. We're now doing the same thing in a mammalian model. We cut off the digit of a mouse, and we're regrowing the mouse finger. This is going to happen so much faster than you think. I mentioned we have a supplement division. We have 4 products, and I have very limited time, so I'm really sorry I'm going through this so quickly. But fundamentally, we're trying to get these natural products out now to modify how you age. We have the ketone ester, which puts you into ketosis, and third-party research says that'll allow you to live longer. We have another product which mimics the active ingredient of broccoli, which works on an antioxidant. It's truly an antioxidant as opposed to taking vitamin C. And then we have one that you should probably take from the minute you're born, because the 50% of your biological membranes across all your cells will decline by 40% starting the day you're born. We can prevent this with this product. And there's another one to clean up the junk, which as you age, you no longer can do, called autophagy. I said we run clinical studies. This is why I can confidently say to all of you, if you take our product in 15 to 30 minutes, according to this graph, you're in ketosis and you stay there for 3 to 6 hours. I take it in the morning and I'm there for 6 hours, and it's about 4 o'clock before I eat. So huge market opportunity, deep domain expertise. We've been around since 2017, diverse pipeline. and this ebb and flow of nutraceuticals versus pharmaceuticals, which is going to be a brand new sector. The longevity lipid could be a multi-billion-dollar drug. So it's a big, big change. Why do you care? Jeannie Clement, the woman who says she's doing 117, supposedly lived to 122. She had a reverse mortgage on her house, which meant that as long as she lived, she kept the house. Interestingly, her daughter died, and then the daughter's husband moved in with the mother. There's a lot of theories that perhaps the mother died and the daughter and the husband moved in to keep the house. Not allowed to say that to French people. She's a legend. Li Cheng-yung claimed to live to 256. Probably not true. But the one thing I'll say about the regeneration is I'll assume everyone in the audience, no one wants to look like Li Cheng-yung as they begin to age. What we're looking for is to change in the same way that we're doing in automotive industry, where we're able to refurbish a car, we're able to prevent the wear and tear, and change how you age. And a lot of the conversations coming with future speakers is going to be about that topic. So our goal at Juvenescence is to prevent that and modify it. I want you to be like this gentleman. His name's Klaus Obermeier. I ski. He has better form than me, skiing. He's 99. I want you to be young at spirit, healthy of body as you age. We want to give you back that extra day of the week. So thank you very much for your time. They didn't think I'd get through the slides in time. Greatly appreciate you all coming.